TV5 News at 9. It's Head and Neck Cancer Awareness Month. Head and neck cancers account for 4% of all cancers right here in the United States, with 67,000 new diagnoses annually. Telling us more this morning, Dr. Jeffrey Hotelling from Karmanos Cancer Institute at McLaren Flint. Dr. Hotelling, thanks for being here with us.
Thank you for having me.
Yes, of course. So there are several types of head and neck cancers. Tell us, what are they?
So there are multiple different types of head and neck cancer. So if you look at the head and neck in general, really any structure there can develop a cancer, everything from the tonsils, the voice box, the back of the throat, to the thyroid, the salivary gland. So there's a very wide range of pathologies that we see in the head and neck.
So tell us, what are the most common and what are some risk factors for these types of cancer?
One of the most common that we're actually seeing now are cancers in what's called the oropharynx, which is essentially the tonsil in the back of the tongue. So these have become much more common now, particularly as some of these cancers are driven by the HPV virus, something that I see very frequently in my practice. Risk factors for head and neck cancer in general, the historical factors are smoking and drinking, so alcohol and tobacco, as well as chewing tobacco, and then even betel nut, which is something that's not as common in this country. And then in addition to that, again, as I said, the HPV virus is also one of the things that's been driving some of the cancers that we see.
Dr. Hotelling, tell us, how are these cancers detected? Are there like routine screenings that people should know about?
There are routine screenings, so sometimes these are caught by dentists or from a primary care physician. One of the most common things that we see is actually a patient who presents to their primary care physician with a mass in their neck or a lump in their neck. And any neck mass that doesn't go away, we typically say, we'll treat with antibiotics. And if it doesn't go away within about 2 weeks, they should be seen by a subspecialist. Other things that patients will present with is difficulty eating, difficulty swallowing or pain in their mouth, difficulty breathing, changes in voice. Really, any of these symptoms that don't start getting better within a week or two typically warrants evaluation, particularly in an adult.
And with these types of cancers, how are they commonly treated? And tell us a little bit about your role in treating them.
Sure. So these cancers are treated typically with a combination of surgery, radiation, and chemotherapy. And depending on the type of cancer, there are times where either one of these modalities or a combination of them are used at once. Depending on where the cancer is. So I'm a head and neck cancer and reconstructive surgeon. So I do everything from removing small cancers from the tongue, removing thyroid glands, all the way up to, removing significant portions of the mouth or throat and transplanting tissue from around the body to reconstruct those. There are times where surgery comes into play after patients have had radiation or chemoradiation. And there are also times where we do surgery up front with the understanding that depending on how everything comes back pathologically, they may need what's called adjuvant therapy or chemo or radiation after surgery, depending on that pathology.
So if someone is in need of the things that you just described, how can they reach out to you to get a consultation?
So they can just go to mclaren.org/Flint Cancer, and they can certainly find us and all of our specialists that way.
All right. Well, Dr. Hotelling, thank you so much for being here with us this morning.
It's my pleasure. Thank you.
Yes, of course. You can find more information in the hot link section of our website, WNEM.com.